you. Our next witness is Dr. Thomas Zimmerman. He's the Director of Osteopathic Medical Education and the Program Director of Osteopathic Family Medicine Residency in South Nassau Communities Hospital. Dr. Zimmerman is testifying today on behalf of the American Osteopathic Association, which represents more than 67,000 osteopathic physicians. Welcome.
Thank you. Chairwoman Velasquez, Ranking Member Graves, and members of the committee, thank you for the opportunity to testify before you today. As an osteopathic physician, board certified in family medicine, a health information technologies consultant, and a member of the American Osteopathic Association, I have witnessed firsthand the challenges facing our nation's physicians as pressure mounts for these practices to implement HIT systems in the coming years. Clearly, the incentives offered through the HITECH Act beginning in 2011 and the subsequent threat of penalties beginning in 2015 are expected to encourage many physicians to adopt electronic medical record systems. However, from my experience and that of most research, I find that the biggest stumbling block to EMR implementation for many physicians' practices is financing. For this reason, we wish to express our strong support for H.R. 3014, the Health Information Financing Act of 2009. The AOA represents 67,000 osteopathic physicians across the country. Our profession is unique in its focus on primary care, with approximately 60% of osteopathic physicians entering this field, the vast majority of whom practice in community-based settings. However, inequities in our current Medicare payment system have resulted in onerous financial burdens for these physicians, whose practices generally operate with 1 to 6 employees. While our members are eager to adopt more streamlined administrative and clinical systems, narrow profit margins and high overhead hinder investments in new innovations such as health information technology. Many of these systems require a considerable amount of capital to purchase. The average cost to install an EMR system is $32,000 per physician, according to an MGMA study. Other studies have placed this cost much higher. The funds provided in the American Recovery and Reinvestment Act early this year offer financial incentives that will facilitate the implementation of these systems. Because these incentives come on the back end, however, smaller practices are at a significant disadvantage. Under current law, we believe that the bulk of stimulus funds are likely to flow towards hospitals and larger specialized practices, ultimately making the rich richer while small practices work to build up the funds and infrastructure necessary to qualify. With the timeline established through ARA, it is our belief that only a small minority of small physician practices will qualify for the 2011 bonus. Additional government support, including the loan program in your legislation, would level the playing field, enabling and encouraging many more small practices to implement EMR systems. As you well know, the economic crisis in this country has hit small businesses particularly hard. Solo and small practices in the past often turn to home equity loans to fund business investments. With the current credit crunch, access to these loans are also severely limited. H.R. 3014 would grant physicians access to private lenders through guarantees issued by the SBA. We support the targeted nature of your proposal, which directs funds towards the specific equipment, training, and maintenance services necessary for our practices to meet the guidelines set forth by the Department of Health and Human Services. The AOA recognizes the promise of increased productivity, prevention of medical errors, reduction in healthcare costs, increased administrative efficiencies, decreased paperwork, and expanded access to affordable care offered by HIT. However, these benefits cannot be achieved until physician practices have clear guidelines from CMS as to the standards to ensure interoperability across systems. We expect these guidelines and the definition of meaningful use to be published by the year's end, but with just 12 months to purchase and implement a qualifying system, we believe that this timeline is overly aggressive and inadvertently favors large institutions. The administrative costs associated with the adoption of HIT systems also present an obstacle for small practices. The initial transition period involves considerable time for both the physician and support staff, who may require outside training and consultants. During this time, physicians' office decreased patient load by up to 25% for several months. These increased training expenses, combined with decreased revenue, creates a formidable cash flow problem that many small practices may not be able to accommodate. The loan program in this legislation accounts for these factors by allowing the funds to be applied towards extra administrative costs. Ms. Chairwoman, your legislation paves the way for small practices to join larger institutions in implementing HIT systems that will improve the delivery of care across the spectrum of healthcare. We commend you on your recognition of the challenges facing our members and the sound policy you set forth in H.R. 3014. On behalf of the AOA and my colleagues, thank you for your efforts, and we look forward to working with you and your colleagues throughout this promising period of transition.
Very good, on time. Thank you, Dr. Zimmerman. Our next witness is Mr. Ryan Fogler. He's the president and owner of Dog